With Dr. Jeff's mobile clinics, the staff has to be prepared for whatever walks up.
That's a Camel, and this is a baby.
This is Sullivan.
Hi, Sullivan.
Trying to eat your shirt.
Yeah, you like my shirt? Yeah, we don't see a lot of camels in America. How old is he?
He's 1.5. He's the third baby we've had. We breed them.
Are they pretty expensive?
The white ones are pretty rare and they're pretty expensive. You know, when I first got into it, there's only 50 white ones in the US, and there's probably around 100 now.
That's cool.
I came over to Dr. Jeff's mobile clinic today to get my camel, Sullivan, gelded. We've got his mom at home, so we can't keep a bull camel at home with mom.
The owner had the mother at home, and people don't understand this, but siblings will mate with their mother. Tasha, you want to bring the stuff out for our camel? About 500 pounds.
500 pounds?
It's the first time I've been that close to a camel, yes. I've never touched one before, and it's certainly the first time I ever neutered one. But I'm not concerned. I have neutered lots of bulls and even a llama recently, and they're all pretty much the same. Camels are sensitive to anesthesia, so the dose we'll use is about 1/4 of what we'd give a horse. And while Sullivan's sedated, we're gonna have to keep a close eye on him. It's the golden rule of injectables. Once you put it in, you can't take it out. You're getting drowsy. You're a big old pig. It's okay. And I kind of feel sorry for the species because they have unusually small testicles for their size.
We're doing a good deed for the animal. A lot of unhealthy stuff that it has goes away with its testicles pretty much because it's going to live longer, it's going to be less likely to have cancer.
The anesthesia is going to be a little tricky. The camel's not going to be fully out, and we're going to have to be fairly quick about this. Okay. That's it. His testicle's really slimy. There we go. This seems a little funny that these testicles are so slippery, but the reality of it is I don't want to give this animal any more anesthesia, so I really want to get this done. Okay. If it decided to get up all of a sudden and give us a kick, you can imagine how that would feel.
You really need to pick up the pace, man.
I'm gonna open this up a little bit more. That's it. He was actually pretty cool through the whole procedure and woke up very uneventfully very soon afterwards. He's a little bit stumbly still.
I'm trying to find his feet. All right, well, thank you very much.
Thank you, Kim.
I
Really appreciate it. It's really cool. Yeah, take care.
I appreciate it. Thank you very much.
That is definitely one camel with 2 less lumps.
Occasionally people seek out my advice because I've been doing exotics in Denver for a long time. He's about 3 weeks old because his head is mostly covered with down.
It's cute. It's cuter than I thought it would be.
A lot of people buy ducklings for their kids for Easter and decide that a duck isn't the pet for them, find some pond and let the duck go. Most of those ducks get eaten. Luckily, somebody found this guy, but it's not able to use its right leg. We're getting him anesthetized so we can take the pre-op x-rays, pull that leg straight down, and it should be good. Let's see what that tells us.
These are cool looking.
God, it's really hard to see the pelvis. This looks suspicious right here, but I'm having trouble following a lot of it.
Looks like the acetabulum is broken right there.
All right, now I can see it a little better there. Yeah.
The right hip is dislocated. We're going to do a femoral head osteotomy so that the duck will be able to walk. You can't shave feathers. Once these feathers are plucked, they'll grow back in relatively quickly.
Okay. We have a plan. Let's get into this. I'm just gonna cut that. That's the ball right there.
Yeah.
Huh. What do you know? If you can just rotate that a little bit.
No worries.
I'm just gonna start nipping away at it.
In a dog or cat, we would normally file down the bone. In this case, we've got a very young animal who doesn't have really solid bone. So we're using this device, which is called a rongeur, and we just nip at the bone and take little pieces at a time.
It's weird how delicate that bone was. I wasn't even squeezing hard and it just came off, yeah. Have a feel of that and see what you think. see if anything is rubbing. We're trying to reduce that contact so it's comfortable.
I like it.
Okay. I don't want to take any more, I don't think.
No, I think we're good.
Look at how cute he is.
Now all we have to do is let the duck heal. I'm gonna take him back to the shelter, and then they'll either adopt him out or we'll get him set up in a sanctuary.
Hi. I'm sorry I woke you up. I'm sorry.
Yeah, we don't come out during the day.
The 3 sugar gliders, Dax, Cork, and Wicket, are getting anesthetized for neuter surgery.
Sugar gliders kind of vary in popularity as pets, but they seem to be on the rise again.
That's a big boy. They do have a very pendulous testicle, scrotum area. I was actually cutting them before like I would do a dog and tying them off, but Dr. Beyer says you don't have to do that. I've never met a vet I couldn't learn something from. Never met a vet I couldn't teach something to.
Just take the cotter, stretch it out, zip it off.
So you just kind of pull it up, clamp it, and cauterize. You don't worry about it bleeding?
No.
Let's make this happen. Push it, yep.
The cauterizing knife heats to 2,000 degrees. It cuts and seals the tissue at the same time,
Okay, I'm gonna glue that.
which means sutures aren't needed for small incisions.
Okay.
Okay, done? Okay, do you want to take him to the oxygen?
Jeff moves on to sugar glider number 2.
Almost got it. Zap him. Okay. Okay, grab his feet. Roll him over and grab his little feet and pull him back. No blood.
Is that good?
Oh, nothing. Can't see anything.
Okay, that was pretty good.
That's really good.
Okay.
2 sugar gliders, 4 testicles, 1 sugar glider, 2 testicles to go. Push it across pretty hard. Okay. So,
Okay.
we did it Dr. Beyer's way. It was really fast, and it went really well. They're all awake, doing well. They should go home and be fine.
I put together the post-op pain medications, and then I put together a combination of sedatives that'll help prevent the self-trauma for the next 2 to 3 days. We're doing this to prevent them from traumatizing themselves after surgery. They will chew themselves open. If you disrupt their skin, they feel like they must make the wound bigger.